Greetings, salutations. So glad you could join us today, October 8th. Can you believe it? And fall is arriving. It's getting a little chillier. It's beautiful here in Ohio, fall colors, and we're so delighted you could join us for today's presentation on CareSource. And we're so proud to have our friend and colleague Tony Caito from CareSource. And Brad, if you wouldn't mind, talk more about Tony, and we'll get started.
Yeah. Yeah. Good morning, everybody. Thanks for joining. Sorry you're not seeing mine and Jeff's slides. Some technical issues, and we just want to keep Tony on his presentation. Uh, but Tony is our regional manager for CareSource. He's been a really, really great asset, especially to me, because we're both here in Northeast Ohio, and also for Jeff, even though he's 4 hours away. But I'm really excited for what you're going to hear. I got to hear it at a presentation a few weeks back, and I was really excited. And I think CareSource is going to have another great year. So 2 years in a row for us to see what you all do. So Tony, and Tony doesn't have video, guys, because of this technical issue. So you'll just have to be mystified by his voice and not just his looks. So Tony, take it away.
It, Trust me, it's too early in the week to have to look at this monster's face. Although it would kind of fit into the whole October Halloween theme, but yeah,
Go.
thank God for small miracles here. Yeah, I'm very excited about next year in the marketplace. What's going to start in November. We've got some good plans here. Always enjoy working with you guys and having the opportunity to address your agents. Now, you just want me to take it off from here?
Yep, kick
Yeah,
it
kick
off.
it
Yeah,
off.
go ahead.
Yeah,
Yeah.
All right, very
we're all
good.
here.
I
Thank you.
removed a bunch of the slides that you saw, Jeff, because I figured they weren't germane. We're not going to go over the DSNP. We're not going to go over contracting and stuff like that because you guys will handle all that. So
Yep.
it'll be a little bit more pared down from what you saw. But the first thing we always like to do, come on, slide.
Your
It's not
down arrow
progressing.
button. Your down arrow button might work, or one of those
Yeah, no,
buttons.
it's not working. Not working.
Do you? How massive is it to send it to me, Tony?
Uh, Give me 2 seconds.
Guys, Jeff, I'm going to let you fill
Okay,
just about what's going on in the industry
I'll
while
go back
Tony
on
sends me
camera.
this.
I'm delighted to help.
Yeah,
Yeah,
go back on
Sorry,
camera.
I,
everybody.
I'm going to turn on the camera again, and I
All
want
right,
to
I
point
just
out.
sent it to you.
Okay.
Okay, and it's like stretch, filler. Okay, so I do want to point out. Brad and I are your dynamic duo of the individual market, everything and anything you need in terms of the individual ACA or ancillary. Please reach out to us, and I'm going to read off in fact, I'll share my screen if that's okay, and then I can toss it back to him. Okay. Um, Brad, just let me know when you get that email,
Okie
and
doke.
then I'm going to send it
Not
back
yet.
to
It's,
him. So
it's
there
probably
we are.
decently sized.
Okay, and be prepared. We're going to have a very fun and factual analysis of the individual market here coming up towards the end of the month. And look for that invitation in your emails. What are we calling this, Brad? Like two bald men talk about insurance or something like that?
The bald
But
guys.
two bald guys. I love it. I love it. Yeah, our marketing team and our focus groups decided that would be an ideal topic for Brad and I. Brad,
It's the
a
truth.
nice series um, for our partners, our broker partners, and we'll go over all of the data associated with the Affordable Care Act and the markets in Ohio and some of the surrounding states. And we're going to have a chock-a-block. It's like 10 pounds of potatoes in a 5-pound bag is what it's going to be. So look for that coming. I think in a couple weeks. That's going to be coming up.
Yes, sir.
So
I am
um,
sharing. All
Okay,
right, we're ready to go. All
we're
right,
ready to
Tony.
go.
Hopefully you can see my screen, Tony, and you know where to direct me.
Yep, I'll just give you the boop, and then you can go
Okay.
ahead and switch
All
slides.
right. Cool. Thanks everybody for being patient with us, but that just gave more time for all of you to join. For those of you who were joining just as we were starting. So fire away, Tony.
Yeah, go ahead and you can go to the first slide.
Yep. This
There you
one.
go. It did work on your end.
Yep.
But is it not working for you either? We always like to start off by explaining a little bit who CareSource is for those of you that aren't familiar. We have been in business for over 30 years. We were primarily a Medicaid company for probably the first 20 some years of our existence. When the ACA opened up, we were one of the initial carriers. We stayed with the marketplace the entire time, unlike some of our competition that jumped back out. We are currently in several states. Arkansas, that's a Medicaid only situation. Georgia, Indiana, Kentucky, Michigan, which is a new state for us this year. North Carolina, Ohio, and West Virginia. We do have something going on in Wisconsin. We did buy a company there. They are going to remain common ground for this year, and we're not sure how we're going to meld that in the company. But for 2025, common ground in Wisconsin, if you sell there, is still going to be a separate entity, although they are owned by CareSource now.
Nice.
Obviously, it'll merge at some point, but not this year. We currently have over 4,500 employees in 30 states. And like I said, our main product line is Medicaid, followed by the marketplace. And then we have a DSNP available in Ohio, which if any of you guys sell the DSNP plan, I'm hearing from the brokers that it is the top DSNP plan in Ohio this year. And we also have it in Georgia. About 90% of the income that we bring in goes back to the members. That's, I think important to note, just because this isn't, we're not, because we're nonprofit, we're not for profit, right? And so every extra dollar we get, we put back into the members. Different type of programs. I mean, our utilization management is renowned throughout the country. We have a program called Life Services that helps people get job training and job placement, helps with child care and rental assistance, or if you need help with a resume, you're given a life coach for 2 years to help you improve yourself. And that's built into every one of our products. And it's not something that you have to pay extra for. It's built into each plan. If you guys ever want to know more about that, I would hook you up with somebody from that department who can do a much better job of explaining it than I do. Okay, you can go to the next slide.
Map.
Yes, we're going to go over the maps. Okay, here is our marketplace service footprint for the state of Ohio. You can see we're in every county except for Knox and Athens. I do understand that we are in negotiations with a hospital in the Athens area, and those negotiations are looking good. Could be signed here relatively soon, not soon enough for 2025 to get on the marketplace, but we should see that Athens is going to be completed next year. Knox County, most carriers don't have Knox County. There's one hospital system. They just don't want to play ball. I think they're with Anthem and United Healthcare, maybe Medical Mutual. But Knox County has been an issue. I do understand that the state of Ohio Department of Insurance is working with that hospital basically to get them to knock it off, but we'll see what happens there.
It's a problem for every
Ohio.
carrier.
It is.
Yeah. Or they have been a problem.
Next slide. Yeah. I guess, you can, you do. Okay, Georgia. The light purple is our current footprint, and the dark purple is where we're expanding. Basically, we're going to be expanding in Augusta. That area in the top right, dark purple, and then we're filling in some of the areas in Georgia. We may be in some of the counties in the rating area, but we weren't in all of them. So we're expanding in those rating areas. There's no new rating areas, just adding more counties in each rating area. Next slide.
Sorry for the
Kentucky.
lag.
What's that? Yeah, there's a little lag.
Sorry for the lag. There's just a little bit of a lag. Sorry.
Yeah. Technology is what technology is. Kentucky, you can see it's kind of looks like it's got the measles. We did actually pull out of a couple counties around Lexington this year. We had issues with a hospital system. We couldn't negotiate the contract, and so we actually lost some counties due to not having a credible network. There's no expansion in Kentucky this year, but we are looking to get all that righted, and we're hoping to get within the next couple of years fill out Kentucky. But for this year, no expansion in Kentucky. Next slide. Indiana, statewide, going to stay statewide. Indiana is probably one of our strongest marketplace states. We have a large percentage of the membership there, and the numbers for us are running really strong in Indiana. So we're very proud of that. Next slide. Same for West Virginia. The interesting thing about West Virginia is that we only have two carriers. It's just us and Highmark. Our plans are very similar. Our networks are very similar. It just comes down to the price here. But we've seen a lot of growth. The Medicaid redetermination hit West Virginia the hardest of any of our states, and so the number of marketplace members went through the roof in West Virginia.
Mm.
Next one.
Wow.
North Carolina. Again, the light purple is our current footprint, and you can see we're expanding in the dark footprint. This is basically Winston-Salem and Charlotte. So we're going to be picking up about half the state this year. We do have contracts signed with a bunch of hospital systems further to the east. We just need to fill out the providers. So you should see this. We're going to probably expand more for 2026 to the east. And by 2027, we should be statewide in North Carolina. But there's a large population in Charlotte. So, and then here's our Michigan footprint. As you can see, we're only in 6 counties. It's basically 3 rating areas in Michigan. This is a joint venture with a carrier called HAP. They're kind of the CareSource of Michigan. And so when you're looking for this, you're not going to find it under CareSource. You'll find it under HAP CareSource. Obviously, it's going to be available on the marketplace in any EDE that you use. But again, it won't be CareSource. It'll be HAP CareSource. Whenever there's, a joint venture, these state-based exchanges like Georgia's going to this year, we know it just never goes as smoothly as expected. So we just wanted to take a small bite out of Michigan, make sure all the kinks are worked out. But the great expansion that's going to be happening in Michigan, in the preceding years, or the following years.
Yeah. So Tony, explain that a little bit. So somebody would need to be contracted with HAP in order to sell No. Okay.
No. CareSource is basically running the marketplace in this joint venture. So there's no HAP marketplace contract. It's just the CareSource contract. If you are licensed in Michigan, all you need to do is call sales support and have Michigan added to your contract. That's it.
There you go. And we can help with that too, gang.
Yeah. So the service is going to stay with CareSource. The commissions stay with CareSource. Everything in the marketplace stays with CareSource. The only difference is that, HAP did appoint some FMOs of their FMOs in Michigan. and they control those relationships. We control the relationships outside of Michigan that sell in Michigan. So it's kind of trust me, it's a little bumpy between how it's working, because some things go with them, some goes with us. But for you guys, it's all CareSource.
Okay, good, because that's why nobody responded to a marketing effort we sent to Michigan agents. I know, because most of them all have HAP. So I'm glad to know
Yes. Yep.
that we could still have our bit. So thank you.
Yeah, absolutely. You know, it's you know, there's a little bit of jockeying going on between the two carriers. You know, who's in charge of this, who's in charge of that, which is expected. But again, for you guys, everything is CareSource, and we expect that'll all get smoothed out as we get into next year. So
Okay, good, because we have a whole lot of agents in Northwest Ohio, as you know, Tony, who
Yep.
Cross that state border because it's only a little bit away. Although Monroe County is not in network, but you just go up, and I think that's kind of near like Romulus and the airport, that southernmost county. Easier
Yeah.
to get to, so it should be good there. All right,
Yep.
carrying on.
Yep. Okay, very good. Next slide.
Thanks, Tony.
Hey, Tony.
Okay.
It's Jeff here.
Yes, sir.
I had a real quick
Yes, sir.
question. And by all means, if you do have a question, put them in the question box. We're monitoring this as we go along. But I had a quick question for you in terms of those states. Are they all sold exclusively on exchange, or are there any off exchange channels?
We do have off exchange in every one of those states. The problem that we have with it is that we didn't get very creative with it. So basically, the on-exchange plan is identical to the off-exchange, or vice versa. The rates are exactly the same, and it's a paper application. Right now, that's all going to.
Oh no.
Yeah.
Okay. It gives me the highs when I hear paper application. But
trust me.
okay,
Right?
so
long enough.
yeah, I'm just an old insurance agent here, but and the reason I bring that up, and that's including Ohio, right? You know, there are some situations where they're shopping this through an ICRA, and off exchange is sort of the go-to channel for that, and I'm sure there's a solution there, and we can certainly chat offline about that, you and I, and Brad, but I just want to know that.
Good to know.
We were very close to a solution. We realized, some of us a lot sooner than others at CareSource realized that paper app is not the way to go.
No.
And so we started, and we had something lined up. But once the IT people got involved, they realized, they said, there's just no way we're going to get this done by open enrollment. And so it got pushed to next year. So we will get digital apps, probably sometime the first quarter of 2025.
Oh, that's great. That's
coming.
Super.
It's coming.
Yeah.
Right.
And I don't think paper is really going to work with some of these ICRA platforms, but that's good to know, and I appreciate you being candid about that. I really appreciate that.
Yeah. And we also are.
Go ahead, Tony. I'm sorry, I interrupted. Carry on.
Oh, it's okay. We are also for 2026 going to be coming out with specific off-market plans. So they're going to be a little bit different. We're going to be tailoring them towards the ICRA market. I'm an old group guy, and so I keep my finger on what's going on in the group market. So we're going to kind of tailor some of the plans to look more like the group offerings on the off exchange. So you'll see different benefits off exchange, different premiums. So we're finally going to grow up and do off exchange right.
Great.
Nice.
Great.
Nice. ICRA is the big buzzword, as you know, Tony.
Yes, I do.
And we've been talking about it a lot too. And it's actually not a buzzword anymore. It's becoming real. So, all right, carry on. Didn't mean to take you off the base.
No. This is I prefer conversations versus
Me
lectures.
too.
So
Us too. Us
interrupt
too.
with
Us too.
questions whenever you got them.
Yep.
Okay, here's our bronze plan for 2025. Basically, there's not too much of a change here. The low premium bronze, this is the one that we did have it available in all of our states a couple of years ago. It's just going to be in Indiana this year. This is the standard bronze plan that existed forever. High deductible, high out of pocket, no copay, right? That'll be available, but only in Indiana. We don't have a whole lot of sales in it. Indiana had the most, which is why they wanted to keep it. The other states, there was so few in it that they just said to drop it. Our bronze first, we've had this bronze plan since we got into the marketplace. We take a lot of pride in the fact that it for the longest time we were the only carrier that had a bronze plan that had copays. And now that we've got into federal standard plans, the federal standard bronze plan is basically CareSource's bronze first.
Yes.
So we kind of think, we've got the market on it.
Yeah.
I hate the fact from a competitive standpoint that I don't have that product to hold over the other carriers anymore, but there it is. Obviously, with the way that the marketplace works, whenever CMS raises the out-of-pocket maximums and the allowable deductibles, the carriers got to go up, right? It's just a fact of nature. So the deductible's going up a couple $100, as is the MOOP. Co-insurance is staying the same. Our primary copay is $50, the specialist $100. Again, this is the federal standard plan you're going to see with all the carriers. We still have the bronze HSA, but it currently is only in Georgia and Indiana. It's going to remain only in Georgia and Indiana. We don't have a bunch of large numbers on that plan. One of the things that we're talking about doing is actually offering a bronze plan, an HSA plan that actually looks more like the low premium bronze, because the deductible and the MOOP are so much lower, the premium is actually a little higher, right? And most people on the bronze side that want HSA are looking for lowest premium, maximum out of pocket. So we'll probably come out with that plan in 2026. So look for that. But this year, the only HSA bronze plan we have is in Georgia and Indiana. Next slide. Okay, here's where we got a bunch of changes. We have this new plan, this HDHP Preventative Silver. Why we just don't call it the HSA Silver, I don't know, but it is HSA compliant. I really think that this, getting rid of the fact that we have a paper app, this is kind of in line of what we're looking at for next year, right? For the ICRA. I know a lot of the groups out there have $5,000 HSA plans. Some have $3,000 HSA plans. This one here is a $5,500 deductible, 100%. And it's an HSA, so I think that could match up well with many of the groups in the ICRA market. We also we're keeping the low premium silver. That has actually been our best seller on the silver side. The Silver 5000, that's the federal standard plan. We don't have too much expectations on that, as I don't think most do. Then we have a plan that's just only available in Kentucky, and I don't know. You guys deal in Kentucky?
We sure do.
Or you like everybody else pulled out of there? Yeah, you guys okay? It's amazing to me when you look at all of the states that we're in, the high percentage of brokers sales that are part of it. In Georgia, it's almost 90% of the marketplace is done by brokers. In Kentucky, it's dropped below 20. And it's Connect. Nobody likes Connect. That's a pain in the butt.
I was going to ask Jeff to say it, Tony, but I know you did, so you took the words right out of Jeff's mouth. So,
yeah,
well done.
Yeah, it's an actual horrible platform. Every broker that I talk to says you can't get a sale done in under 3 hours. It's just a nightmare. So
And I
I
need to
know a lot of our
intervene.
Kentucky brokers.
Yeah.
Yes.
And if I could, do you know,
A
a
PSI.
a PSA, you're right. They are working
Yeah.
really, really hard to remedy that problem. They're fully aware of that, and they have streamlined the process this year on their application
Good.
platform. It's the same platform as always, and there's a lot of emphasis on other stuff, and, Medicare, Medicaid, that kind of thing. But there's trying to streamline it to the point where if your income is above a certain threshold, you won't be sent down those other paths. So I haven't
Oh,
seen it
good.
in action yet, but they say it's going to be an improvement over last year. And there is just tremendous opportunity in Kentucky, and that's my PSA for Kentucky.
Oh, oh, absolutely right. Because the brokers have exited. Anybody, I've got one broker that I know personally that he does a lot of Kentucky business, and I told him you ought to put up a billboard that says I'll do it because most of the brokers there won't. But if they fix that, that'd be great. Be nice to get the brokers back in there.
Jeff, are they going to be, is just real quick, is Kentucky going to be doing any training for brokers or have something online where they could see the new process? Have you heard?
It's in the refresher training.
It's in the
So
refresher training.
when you do the refresher training, and there's also some other materials, some other bulletins out on the website, Kentucky Online Gateway Connect, and agents that have gone through the application and have seen the new application say that it's better. So
Okay, good.
Yeah.
Good. That's the most I've
That's
ever
great news,
talked
Jeff.
about Kentucky. Yep. All right. Talk about those
Yeah.
really great silver plans that are special, Tony.
All right. Well, first we have the diabetic silver. This plan is available now. It's actually blown our forecast out. The number of people who have signed up for this. Even though this is a diabetic plan, you don't have to be a diabetic to get into this plan. But it's got a very low deductible. The out of pocket's a little high, but the benefits on this thing, right? We're looking at a primary care of $30. We decreased the specialist visits. Currently, it's 80. For next year, it's going to drop down to 50. And then you've got these really low prescription copays. But most of, and there's another slide coming up, and we'll take a look at it. But a lot of the insulins, the test supplies, these are all coming at $0 copay. So for the diabetic, if you have somebody who's pre-diabetic or maybe is just on like metformin, a generic $4 a month drug, maybe the cost benefit analysis on this plan doesn't work. But if you've got somebody that on the insulin, they've got the pumps. This plan seems to work really well for them because of the zero copays. And because of the fact that this plan is going so well, we're adding a healthy heart plan this year. So it's basically the same plan, a little bit different on the deductible side. Copays are the same. The prescription copays are the same. Now, this is going to be for people that have heart conditions, right? And you're going to start seeing, I know Ambetter's coming out with a diabetic plan this year. Anthem's got a diabetic plan. I think Oscar has one as well. I think, I can't remember, maybe Aetna is the one that has the COPD plan. But you're seeing carriers come out with these plans, and it has everything to do with the way that the marketplace operates. I've been in the insurance business since '88, and for most of that, we always wanted the healthy member, right? Premiums paid, no claims going out was good. Nowadays, that's bad, right? I still can't get a hold of it, but young and healthy people are not good for the marketplace. If you have conditions, you're good. It has everything to do with the way that the government funds things. So if somebody has conditions, the government gives the carriers more money, right? If they have no conditions, then the government takes money from the insurance company, right? It's called risk adjustment.
Yep.
And so CareSource, we can be running really great for 11 months, and then the government steps in and takes $80 million away from us to give it to some other carrier, right? In Georgia, it's always Ambetter. We always pay Ambetter $80 million. And that's because we've got really healthy members. Ambetter, they have the conditions. So now the carriers are going after the condition to kind of equalize that risk adjustment. So, you can forecast a little bit better. So in this case, we've got the diabetic plan. We're coming out with a healthy heart. Next year, we're talking about maybe an AIDS plan, maybe COPD. But you're going to start seeing us come out every year with an additional chronic condition plan. Eventually, it'll meld into one plan. It'll just be, CareSource chronic condition plan. Because we're not going to have 14 different plans. At least I don't think we're going to. That would kind of be ridiculous. But we're kind of excited about the healthy heart. We'll see a slide on a little bit in the presentation, a little bit more detail. We will be coming out with one-sheeters we did last year, where it lists all of the prescriptions that are built into the plan and what the copays are. So you can keep that on your desk and be able to really quickly say, okay, well, you're on Jardiance. Yep, that's $0 with CareSource.
Nice.
Next slide.
Gold.
We're going to have the diabetes and the healthy heart plan also on gold. There's the core gold, which of course is the federal standard plan. And I'm sorry, the gold 1500, the first one, that's the federal standard. The core gold, that's just available in some of our states. The only reason why we have that is because we actually have a lot of members in that core gold plan, so we left it instead of mapping them over to the gold 1500. Again, standard gold plan. Although we have a lot of members in it, that's relative, right? So compared to bronze and silver, it's a small number, but it's higher than what you'd expect. So there's not a whole lot of people out there selling gold, but we have it. Next slide.
Did you? Well, I'm just seeing the even lower copays for the gold heart and diabetes plans. That just kind of popped out. So looks really good there. So again, I mean, it's the cost analysis, gang, right? If you can buy somebody, if they're highly subsidized and you can get them a gold plan as opposed to a silver plan, yes, they may lose the CSR, but somebody who's just above the CSR, a gold plan may make sense for them because they're getting a high subsidy, just not the cost share reduction on the copay. So it's all in the numbers. As I always say, you got to run them.
It's all in the numbers.
And if I may jump in, we do have a couple questions, and thank you for sending over these questions. And Rod asks, which silver plan is the HSA?
Oh, the first one. Yeah, go back to there.
One. High deductible health plan. Yeah, I'm here.
Yeah.
Sorry.
Yep.
It's this
right there all the way to the left.
All right. Fantastic. And then one more question for you, Tony, before we move on. How do you check the network? And I know you'll get to that, but
you can go on, obviously the EDEs, you can do it, but if you want to go on to CareSource, it's the Find a Doc. It's our provider search tool.
Great.
Got it. I think we're going to talk about, you got that platinum plan, Tony, that's only available in Indiana and West Virginia. That was next, right?
I think this is a product of the product team and the actuaries having extra time on their hands. And so they decided to run out with this platinum plan. We were all went, huh? But they said, hey, we're going to throw it out there. We'll see how it does. We've got bets internally on the membership numbers on this. My number is 0. Some people got, some really low numbers, and we're not expecting anything. Basically, we're floating a trial balloon. If there's any marks whatsoever for the platinum plan, so there's a really good chance that this is a one and done. You'll see it this year. Next year when we do this, it won't be there.
Yeah.
But I guess there's also the possibility that you'll see it expanded to other states because it took off. But I'm sure the premium for a 21-year-old is about $3,000 a month, so I don't know if anybody's
Yeah.
buying this thing.
Yep. Maybe the 63-year-old or something like that in Indiana and West
Maybe.
Virginia. So yeah, there you go.
Yeah.
Okay, we'll keep going.
Yeah. Yep. Okay, here's the details on the diabetic plan. You can see it's 0 for the screening and tests, right? 0 for the drugs. There's a list of all the drugs we have. When you get into the Ozempics, right? I can dine on me. I'm going to leave it at Ozempic because that's the one I can pronounce.
The
Those are going to be
$100
copay. Yeah, exactly. Yeah, Wegovy, right? Ozempic. Those are all going to be at the $100 copay level. Only for diabetics, right? At that level. We do not approve it yet for weight loss, right? There are some drugs out there that we may be adding for the weight loss that are in that category, but at this point they're not specifically for weight loss, just for the diabetics.
Okay, so that would mean. So Tony, that would mean anybody who's not exhibiting to CareSource that they are in fact a diabetic, but on the diabetic plan because it has some other nice benefits, they will not get covered on that benefit, right?
That's correct.
Right. So you have to be legitimately a diabetic, not just on the diabetic plan. Right.
Exactly. And for those the Ozempics and the Wegovys, that has to be pre-authorized, right? And that's basically making sure that you are a diabetic.
There you go. Okay. Thanks for clarifying.
Okay.
Next.
Next slide.
Healthy Silver.
Yep. It works the exact same as a diabetic plan, right? 0 for the test, 0 for the drugs, 0 for the equipment. We are adding more drugs to the 0, since we started, since this presentation was put together. And it's very important that we get the feedback from the broker. So if, you're running into people that have heart conditions that are taking a certain medication that we aren't covering at 0, let us know so we can get it added in. We've had, especially in the diabetic side, we've had a lot of success with the brokers coming in and saying, hey, we need, Jardiance added because Manjaro we didn't have in the formulary last year. It's a start. Brokers called, said, hey, we have to have Manjaro. It's now added in. So feedback from you guys is critical to build this plan out and make it good for the member.
Great.
Any questions on those 2 plans?
I don't see any, Jeff. Do you see any? I'm not watching for them. Jeff.
I was on mute. Sorry. No questions.
Okay. All right. So
okay.
the HDHP, the HSA plan.
Yeah, this is that silver plan, right? That was the HSA compatible. I'm really not too sure how it is qualified as an HSA plan because this is kind of the heart plan and the diabetic plan rolled into an HSA. It's an HSA plan, but you still get the 0 testing and screening, the 0 preventative drugs, the anti-diabetic drugs, and the testing supplies, all for 0 still. So that if you got a diabetic, you got someone who's got a heart condition, they're looking for an HSA, boom, there you go. I think this plan would work great again on the ICHRA market.
Okay.
I agree.
Interesting. Yeah. Nice. All right. Next, let's see. Telehealth, Tony? I think that's what's coming up next.
Yes, I believe so. I don't know how many of you guys are pushing this or using this, but I'm almost an exclusive telehealth guy now myself. The fact that I can call my doctor from my desk. I don't have to get up. I don't have to drive to his office. I don't have to sit in the waiting room. I don't have to be there for an hour, meeting with the nurse before the doctor comes in. I just pick up my phone. I tell him what my problem is. usually within 5 minutes. The doctor is there on a video, and they can prescribe pretty much any medication besides controlled substances. And so that's really the only way. If I got, I got a cold, I got the bronchitis or whatever, I'm just doing it on telehealth. We go from, depending on what plan you're on, a $40 copay to a zero copay. Makes all the sense in the world to me, right? So the only time I personally go see my doctor is when I get my annual physical, which again is covered at 100%. So I control my out-of-pocket costs by doing it this way. And because of the way that they do it, they try to make sure that the doctor is close to where you're calling from. And in all the times that I've used telehealth, I've only gotten a different doctor once. It's normally the same doctor. So we're kind of building a relationship, more so than I have with my regular doctor, because I see his nurse more than anything else. So that's kind of nice. And the other thing is that we have behavioral health built into the telehealth. And that's also at zero. And with that, you definitely continue to see the same counselor. So as I always like to say, instead of laying on their couch, you can lay on your own couch. And instead of paying, a lot of these behavioral health providers are leaving the networks, right? And it's all out of network anymore. And there's still obviously some in network, but a lot of them are getting out of it. So instead of paying $120 or maybe even more, do it on your phone for zero. And again, there's no limit, right? It's not like you're only allowed to have 5 visits on this thing.
Wow. So Brad's having a bad day. Hey, Tony, I see it. It's not really clear here, but who is the telehealth provider? Because I'm not seeing it listed. It is Teladoc, guys. Very important. Yes. Teladoc was, if I'm not mistaken, one of the first telehealth carriers when I started in the business, probably 14 years ago. The biggest and the oldest. So that's really great that CareSource partnered with them.
Yeah,
maybe you should have that put on the presentation, Tony.
I always thought it was.
I'm surprised it's not. Yeah, it's not on here. It doesn't say.
Yeah, so. That's a huge myth. Yeah, that's a huge myth. Because I think it was on last year's.
Yep.
Instead of saying telehealth partner program, we said Teladoc partner program type thing.
Yeah.
Yeah. Okay.
Keep moving.
But it is Teladoc.
Time.
Okay. Big difference here. Going into 2025, our enhanced benefits, right? So when you're on there now and you're looking, you see CareSource Bronze first, and then you see CareSource Bronze first with enhanced benefits, right? Our enhanced benefits product right now has the vision, the fitness, and the dental. For 2025, we are getting rid of the dental. This is temporary. We heard from the brokers, we heard from the members, DentaQuest was not working. It was a nightmare. We worked with them for 2 years to kind of get it fixed. They got some area fixed, but it wasn't working. We were going with, for this year, we were going to go with a flex card for the dental. And up until the end of July, we were getting no problems from CNS about offering a flex card for dental. But at the end of July, they said no. So we lost the flex card. Didn't have time to get anybody else for 2025. So our enhanced benefits won't include dental. It's important to note that if your member is currently on an enhanced plan and has the dental, that for 2025 they will lose it, the dental, right? So make sure your members know that. Even if they passively renew, it's because it doesn't exist anymore. Right now, the enhanced benefit premium is going from basically 12 down to, depending on where you're at, $3 to $4, right? So you're going to get the vision, you're going to get the fitness benefit for the $3 to $4 extra premium. So the premium went down drastically for the enhanced benefits. And again, we're coming back out with dental for 2026. We're in negotiations with several, but one primary national dental plan that everybody knows. Kind of
Hey,
sounds like
Tony,
a Caroline.
I need to jump in real quick. So have you sent some communications out for
Not yet,
these?
but they will in the renewals. Yeah, they will be
Okay.
several notifications to the member going out that the dental is going away.
Okay. And if I may suggest, we could do that multiple times
Yes, it's
and
going to be multiple.
maybe a different way, not just, you know, through a renewal letter, but maybe just through an email blast or something like that. That's just my
I
suggestion.
know they're planning an email. Besides the renewal letter, they are planning an email.
Okay,
And
because we'll need
depending
to stay
on
on top of this, guys. You're not going to have
yeah,
dental if you had it. I wonder
right.
if there's, I'm wondering if there's a way we can zero in on which clients, and you and I can discuss this later. But that'd be nice to just get a heads up to those clients who are losing their dental. And the other thing that I had is, what about pediatric dental? Aren't they required?
That's going away as well because it was going to be built into the flex card.
Okay, isn't that a requirement though? That
Jeff,
plan?
I believe that. You
Maybe
believe
not.
that,
Okay.
but CMS doesn't seem to believe that.
Who who
So
who said that? CMS? You said?
yeah, they said
Okay.
okay. Like,
All right.
yeah, 'cause that was kind of our argument. Well, without that, we don't have pediatric dental, and they said okay, whatever. I thought it was required.
All right. We'll turn the page on that, baby.
Yep.
Yeah,
Okay.
yeah.
Tell us about those
But all
vision
I'm with you on
benefits,
that.
Tony.
Right, right. Okay, our part of the enhanced is the vision benefits. This is through IMED. Yeah, we good. We got that there, IMED. This plan, this works, right? I get zero complaints on this. Everybody who utilizes it loves it. The benefits are really good. Again, we're talking about, I don't know if we want to split the premium in half. We're talking about a $2 vision benefit with these type of benefits, right? Just outstanding. And again, it works. The providers seem to work well. I get, again, zero complaints on this. So you have, your benefits for the exams, the frames, the lenses, contact lenses. We have a discount on the LASIK. You can get an exam every year. You can get your frames and lenses every year. Just a really good vision benefit, again, for $2, and whatever it is, right? It could be $1.50. It makes it a no-brainer. And then when you throw in on the next slide the fitness benefit, again, you're paying that $3 to $4. You're getting the vision and you're getting this fitness benefit. And this isn't a discount, right? This is a full membership. So you can go to places like LA Fitness or Snap Fitness, Planet Fitness. There's basically 7,000 fitness centers out there, right? And again, not a discount. It's free, the membership, right? And so for that $3 to $4, you get the vision benefits, and you get a membership to Planet Fitness. That's just, I don't know how we're making money on it, right? Considering we pay an additional commission on it, it's like we're paying like 25 cents or whatever, to these people. I don't know how they're doing it. But you get all those gyms. You don't have to pick one. It's a national network. So you happen to be on vacation, you can go to a gym in California or Texas. It's just a fantastic benefit. You get the home fitness kits. They get, you go online. They got videos you can follow along to. They got the health living coaches. And if you go to Active and Fit, because you can't see the network on CareSource.com, you have to go to Active and Fit. You put in your zip code, and the number of gyms that are around you will normally astound you. We do have a great working relationship with Active and Fit. So if you do find a member where there's not a good selection of gyms in their area, we've been very successful in getting gyms added to this network. So you run into it, let us know. You need to add a YMCA. because YMCA's aren't like Planet Fitness where you know they're all in. We got some YMCA's here, other YMCA's we don't have. So, you know, if you get into an area and you're like, you know, we really like to add this YMCA, let us know. We'll call Active and Fit, and we'll start that ball rolling. But again,
Great.
you get both those programs for $3-4. That's it's a no-brainer.
Got it. No, I think it's a really great value, Tony. When I saw it, you know, in the past month, I'm like, wow, that's amazing value add for $3 or $4 to really make it worth it between these two. So it's really helpful. Think this is actually the last slide. So I wanted to
That was
ask,
the
Tony,
last slide.
what are rates looking like for 2025 from CareSource? See an
You know,
increase, decrease, push? What are we seeing?
yeah. I mean, every year. Yeah, I think the only carrier that I know of that is getting aggressive this year, and it doesn't surprise me because they do this every several years. But Anthem, I expect Anthem to dominate because they've made a push. You know, our increases were not substantial. But with Anthem coming out, I don't know what's going on with Anecdote. I thought they were coming out. Then I heard that they didn't get approved. But I talked to the Anecdote rep, and he says, no, we're coming. And I'm not sure where they're going to line. But you're not going to see much of an increase on current premiums with CareSource. And depending on where Anthem lands, that can change the landscape.
Okay. I mean, I think in terms of network, CareSource has a more robust network in Northeast Ohio than
Oh
the
yeah.
A1 that you mentioned. I hate to call out
Yep.
different carriers, but I think your
Right.
network is better in Northeast Ohio and a good part of the state. So that makes sense. And talking
Yep.
about rates, Tony, that actually led me to another question. When is that big heat map meeting that you have planned where brokers are invited and they can kind of just get a comparison from one
Yep.
competitor that shows all competitors and where CareSource is more competitive than others? I think it's a really great value to listen into that, gang, if you have time on this date and time that Tony tells you.
Yeah, we just sent those out to the FMOs, the invitations last night, well, yesterday evening. So you should be getting them. The FMOs should be sending it out to you hopefully today or sometime this week. But it's the week of October 22nd, I think. Let me
That
see
sounds
here.
like
It's
week
October
of 21st.
21st.
Okay.
Yeah, so
That
we're
week.
doing
Okay.
Michigan on the 21st. And that'll be at 2:00. And then on Tuesday the 22nd, at 10, we're doing Georgia. At 2, West Virginia. Wednesday the 23rd, 10:00 is Kentucky. 2:00 is Indiana. And then on Thursday the 24th, we're doing Ohio at 2:00.
Very good. Yeah,
So
gang,
those will,
we will get that out as well as the slide deck that Tony wants us to share with you all. We'll send that up in the follow up, and if we get that email with the heat map information, we'll actually add that to the follow up to this meeting. So that's great,
and I'm sure if
Tony.
you reach out to Jim, he'll get it to you right away. The invitation.
To Jim Derrick, right? Yeah, good point.
Yeah.
Good point. That way we can send it out. Excellent, thank you. Everybody on the line doesn't know Jim, but Jeff and I do. So
Yeah.
that's great. Jeff, any more questions? Oh man, I see the
We've got
question
a
box
boatload of
lighting up.
questions. Yeah, it's blown up, and thank you for sending in your questions. So, how do we check the network? And Bernie also, sent me another email, a follow-up email. I did find the CareSource Find a Doctor network or Find a Doctor page, and I'm going to share that with you if you don't mind.
Excellent.
Hopefully you guys can see this. I didn't want to take. Okay.
Are you okay?
Can you guys see this, or
Yeah,
do I need to? You can see that.
yeah. So
Yeah.
it's findadoctor.caresource.com.
Okay.
Which Okay, that's how it's showing here, but
Okay.
that's just that
And
one example, by the way.
mhm. And the next question, um, how would you confirm what IMED network is used? Is it the Access, the Insight, the Select,
You can find that and find a doc.
and Find a Doc? Okay.
Yep.
Oh,
Okay.
interesting. But I believe it's usually Insight, I believe, is the network that's usually an
Yeah,
embedded plan,
that's
if
right.
memory serves right from my days on the carrier side. So
It is
Insight,
Insight.
yeah, it is Insight. But you can also, Tony, saying that when you go on the CareSource Find a Doc, you're going to be able to find those optometrists as well.
That's correct.
Uh-oh, Jeff is looking. It looks like he's looking.
Now,
Wow, we're getting
I
live
will put it
action
this
here.
way. Yeah, I won't put it this way, right? We get a feed from IMED, right? And so then it's got to go
Ah,
through all that computer stuff. So if you went to IMED directly, it would probably be the most accurate and up to date, where ours probably lags. And I never trust when two computers have to talk to each other.
very good. Wow, Jeff. Found 30 of 1,800 providers in the 25 miles of Cincinnati.
Yeah.
That's a pretty good network.
Great
It's
network.
an outstanding
Yeah,
network.
Yeah. That's a
right.
great tool you
Yeah.
guys have. I love this tool. Takes all the
Wow.
guesswork out.
Yep.
And to that end, what is the dental network?
There is no dental network. Remember, they're
That was a trick
taking dental
question.
away.
Right. Okay.
Yeah, trick question.
Trick
Nice.
question. I should have said there wasn't a dental network. What is the dental work?
Yeah.
What is
Well,
the dental network today is DentaQuest, right?
yes, yeah.
So,
It shows a
okay.
robust network, but the problem we run into is every time somebody calls one of the in network providers, they say we don't take it. So,
Oh man.
uh,
I remember
Gosh,
those
yeah.
problems.
I
So,
hate those calls.
yep,
Um,
yep.
What
And
other
so we've
questions, Jeff?
actually found entire counties without a dentist, even though DentaQuest says, "Oh, we got 30 of them." Yep, none of them take it. So,
okay.
Yeah. That's an education problem a lot of times, Tony, from my past
it
experience,
is.
that
It is.
the providers, a team doesn't understand when they say, do you take XYZ? And they say no, but they don't know. Yeah, we had to send an education team in my old days
Yep.
to meet with those doctors or have an outreach program for them or dentist offices for them to understand what it really
Yeah,
was. So
and
it's
that's
just
what
sometimes,
DentaQuest did. But
yeah,
even then that they found is a lot of those dentists said, "Oh, okay, well, cancel the contract." So
yeah,
Wow.
yeah,
it
yeah.
was just a
What other
nightmare.
questions are
Um,
sticking out here, Jeff, that we haven't already answered?
um,
Uh,
pretty much
I
run the
think we
gamut
covered them
there.
all. Yeah,
Yeah.
nice.
Yeah.
We got
Good job.
so the HDHP is the silver HSA plan, or the HSA qualified is the HDHP, high deductible health plan,
Yes.
which we already answered.
Okay.
All right, I think that's no more questions that I can see. So Tony, thank you for making this happen. It's always great to have you on the line, and we enjoy just the back
Agreed.
and forth conversation. I hope our brokers do as well. They've told me that they have. They like the interaction as opposed to just being talked to, because it helps, I think. So again,
Yep.
we appreciate the relationship we have, Tony, and gang, we will be sending out a follow-up. The call is always recorded. So when you get that follow-up email, it'll have the documents, links to the documents, as well as a recording if you want to hear the three of our voices all over again, as if this wasn't enough. So
They'll
everybody,
put it on
thank
their
you for
bedside so you go to sleep at night.
that's us. Yeah. A
Well,
nappy. So, all right, gang. Thank you very much for joining. Tony, thanks very much. Looking forward to seeing you
thank you.
soon, I hope. All right. You got it. Bye, everyone. Ciao. Have a
Everybody
great rest of the week. Good luck. Thanks. Bye.
Bye,
Thanks.
guys.